Hi, everybody. I am Amanda Brummett, and I'm here today with Monica McKitterick. She is a family nurse practitioner and the owner of Impact Family Wellness. Thank you for being here, Monica.
Absolutely. Thank you for having me.
Yeah. So before we dive into direct primary care, can you tell us a little bit about yourself and Impact Family Wellness?
Absolutely. So I have been a nurse practitioner for 16 years now, which makes me like age myself. Uh, but yeah, it's been a long haul. So I did 10 years in the insurance-based system in primary care, urgent care, orthopedics, vascular surgery, all sorts of different things.
Wow.
And was actually relocating to Texas and trying to figure out what I wanted to do with my life. And I've always had a passion for primary care because I was trained to take care of a whole person. But on the other hand, insurance-based primary care is absolutely exhausting. I went into healthcare because I love to create relationships with people and provide care for them. And that is not at all what I was doing. I was doing paperwork all day long, and it
Mm.
was awful. I was also giving patients band-aids for their symptoms. It was like, here's a pill, instead of actually talking about the things that were causing the problem. And so a Facebook ad actually saved me. And it was all about the world of direct primary care. And so
Mhm.
I did a ton of research, went to my husband and said, I think I'm going to open a practice where I can see less patients, take better care of them, have more control of my time, and make the same amount of money. And he literally laughed in my face. And he was like, that's not real life, Monica. That maybe you can have three of those, but not all four. So I Googled how to write a business plan, wrote a business plan, and 6 months later, moved to Texas. 3 weeks after I moved here, I opened my practice, not knowing a soul. I knew two people in all of Central Texas. I had no patient
Wow.
following, none of it. So not only did I have to convince people that I had a clue what I was doing, but also this new model of people like, wait, what membership-based health? What are you talking about? So it was a battle. But I started. My plan was just me in my little office with my hopeful 500 patients. And now, fast forward 6 years, I now have three clinic locations. I have seven nurse practitioners that work for me, and we have well over 2,000 patients.
Beautiful. Okay, well, let's get into the DPC model.
Yeah.
And you've alluded to it a little bit already. How does it allow your team to practice medicine differently than in a traditional insurance-based setting?
Honestly, I can answer that question in one word answer, and that is time. It's
Yeah.
all about time, right? And the number of patients. So in the insurance-based world, those providers are responsible to 2 to 3,000 patients. In direct primary care, it's usually around 500. But yeah, I mean, this is part of the problem is our system makes it seem as though our providers are the problem when they are not. It is the insurance guidelines and regulations. Um, just simple things like, oh, you can only talk about two things at your appointment. Well, that's not because the provider made that rule. It's because of how the office visit is coded. And so, because of that, if the provider talks about more than two, they don't get paid for it. And when they don't get paid for their time, the man in the C suite is yelling at them. And so that's why that happens, right? The same reason women can't get their pap smear and their physical done at the same time, oftentimes, it's because of billing reimbursement. If you do it on
Yep.
two separate days, you get significantly more money. And so, as much as that sucks that you have to take off work 2 days now instead of one, it's how you keep the lights on. And so it completely sucks. And this is why DPC is so much better, is because I can talk to you for an hour. All of our appointments are 30 to 60 minutes instead of 10. And so the bottom line is the reason DPC is so much better for patients is because of time.
Yeah, definitely. So, what all is included in that time with you?
Yeah, absolutely. So I think one of the best things is that your appointments aren't an additional charge. And so I found this very difficult in the insurance-based world is I would see a new patient who is just diagnosed with diabetes, and I should really see them every other week, at least once a month, right?
Oh,
Like
wow.
we need to
Mhm.
really dive into what's going on. High blood pressure, I should be seeing you once a week. However, in that world, you either are on a copay plan, so now you have to pay me 20, 50, $75 every time you come see me, or you're on a high deductible plan, so you have to pay me 135 ish on average every time you come see me. And so the patient is like, absolutely not, I'm not doing that. And then I also don't have the time to do it. Where now, because I can treat my patients via text message, via telephone call, via office visit, I can actually have more hands on in their care. We also have found that most primary care offices now are just giant referral mills, right? We used to have it where I would see a patient and be like, oh, you have high blood pressure. Let's talk about lifestyle changes. Let's talk about medications. Let's talk about all these things. And I didn't even consider sending a patient to cardiology until they were on 3 medications and I couldn't get it controlled, right?
Yeah.
Then they would go see cardiology. Well, the problem is primary care reimbursement is so bad that the only way that these big corporations make money is through specialists, right? So the ER and primary care complete sucks on life in these big giant health conglomerates. This is why they're buying up all the primary care offices, because primary care creates referrals to their specialists. So in our office, all their office visits are included, which is great, right? So their office visits are all included, telehealth, and the ability to text their provider. There's a time and a place I have to lay hands on you. I can't do a pap smear from afar, can't listen to your lungs from afar, but there's a lot of things that we can talk about, from rashes to, hey, I think this medicine is giving me this side effect. Great, send me a text message, right? Because you're at work and I'm at work and we got things to do. And so that just makes our communication much easier. So those are all included. Your annual physical lab work is included at our office. We also have a specialist consulting service that's free of charge for our patients. So as a primary care provider, I know this much about this many things. Oftentimes I need the guy who knows this much about this many things. Well, instead of
Mhm.
waiting 6 weeks to see a cardiologist, I can type up a synopsis. I saw Amanda and she has this problem. What should I do? And within 24 hours, we get a really great answer back typically of like, oh, hey, try this medication or run this lab work or order this test, or no, I need to see them. Can you send them to me next week? Right.
Nice.
And so it's a really great service for our patients. We also have a contract with a local lab to get labs at about a 90% discounted rate. And so we're all about price transparency. So if you want a full hormone panel, it's $27 to our office, right?
Whoa.
It's, for some reason, healthcare is the only world where we cannot tell people how much something costs and expect them to pay for it. If you
Right.
walked into Starbucks and there was no pricing next to it, would you order your coffee?
No.
Probably not. It's like when you get the menu and it's like lobster tail, market price. It's like, yeah, no, that's not
Move
happening.
on.
Absolutely not. And so this is what we do to patients when it's in regards to their health. And then they get these giant bills and they don't know what to do with them.
Yeah.
And so we make sure that all of our patients know what to do. And I think, the biggest thing we do for our patients is we're their people, right? Like, just like a plumber doesn't expect me to know how to fix a toilet, I should not expect my patient to know how to navigate this healthcare system. So when I say,
Mhm.
hey, you need to get an ultrasound, instead of just being like, go get an ultrasound, it's like, hey, we need to call this place. These are the words we need to use, or I'm just going to pick up the phone and call for them, right? So being advocates for our patients, making sure that they're getting what they need and what they deserve, and ultimately talking about all of the things, right? So much of healthcare now is like, oh, take this pill, oh, do this, when really we should talk about the things that actually matter, like sleep and stress and body movement and nutrition. Like, those are the real, like, 4 pillars of health. And if you aren't doing those things, then we're in a world of trouble.
Things
Yes.
like minor procedures,
Mhm.
and you mentioned pap smears. Are there other things that you do every single day for your patients that they might get referred out or might have to do 2 visits at other places?
Yeah, absolutely. So we cut off skin tags, which isn't
Mhm.
covered by any form of insurance unless you can prove that it's painful or causing infections, which is
Oh.
dumb. We cut out abscesses. We do INDs on those. We do a lot of
Mhm.
suturing. So we have not only skin and glue, but actual sutures. Like, I have sewn up more hands and faces than ever before. We also put in and remove IUDs for patients. And then obviously pap smears. And we also do joint injections, which are 100% covered, no extra cost.
Wow. Okay. Yeah, that sounds like a massive savings and convenience, and so great to get it done by somebody that knows you and knows your health.
Absolutely. And that you can call if something's going wrong, right?
Oh,
Like,
yeah.
you get these procedures done. It's like, wait, is that what it's supposed to look like? It's like, yeah, actually, that looks great. So you're good. Mhm.
Right. Okay, let's talk about the employer side of it. How do you
Mhm.
partner with employers to support their employees and health and productivity? And I mean, you've already explained I didn't have to go to the dermatologist and the OBGYN, so there's 2 less days off work.
Absolutely, yeah. So we work with about 90 local employers currently,
Oh, wow.
and we provide their healthcare for their employees. Now, majority of them don't offer anything except for us. They had no insurance before and can't afford insurance, and so we were at least a really good, affordable option that can give them 80 to 90% of their healthcare coverage, right?
Yeah.
Um, the biggest issue with employers is A, they don't know we exist. They don't know it's an
Mhm.
option. And B, they think it's too good to be true. But once you get there and explain, hey, listen, I'm not an insurance company. I'm not taking all of your money. I'm a real person. We can have a conversation. And that there's no strings attached, right? There's no COBRA rules. There's no ERISA rules. There's no pre-existing condition clauses. There's no minimum people that have to join. Um, and there's no like afterward stuff. Like we take care of all of that. We take care of all the onboarding. And so getting them to that point has
Mhm.
been, a bit of a struggle, but we've done it with 90 of them, 90 or plus at this point. But really explaining to them not only the cost savings for them, but also the ability to recruit better people, because especially a lot of these like lower wage places, they don't offer benefits because they can't. And so the only thing keeping their employees at their place is their paycheck. And so if the guy down the street offers them 50 cents more an hour, they're gone. Where if you're at least offering them a healthcare solution, they don't even have to know how much it costs. They don't know that it's only $60 a month at my office for employers. They don't know that. And so it helps with that, not only attracting better people, but employee retention,
Mhm.
and also health, right? And so if you have an employee who's sick and they're missing 4 days because they don't have a doctor, they don't have a place to go, where if they had come to see us, we could have gotten them on the mend much faster. Just the amount of time that you don't miss, A, because of sick visits, but also because we don't practice sick care, we actually practice health care. And so our goal is to keep these patients as healthy as they can.
Do you do workplace like injuries and things like that, minor ones?
We do. And so, we have these conversations with all of our employers like, hey, listen, if you get hurt on the job, call us first. If it's something we can handle, then there is zero reason to file that work comp case because it is going to be ugly and long and drawn out. There's times and a place, right? You cut a tendon in your hand, you got to go see an orthopedic surgeon, right?
Mhm.
But most of the time, it doesn't need that.
Well, and I like that your model that you're the first call because I assume even with a bone hanging out, you still have suggestions on where you should go instead of just going to
Absolutely.
the next door place.
Yeah. Well, and we even encourage this for all of our patients, even if we are going to send them to urgent care or the ER, to call us first so that we can send them to the right place. Because if they
Yeah.
need some sort of imaging, urgent care is not the place for them. And so then they go to urgent care and they waste their time and their money and their energy, and then they end up in the ER anyway. And
Yeah.
so we also have a lot of really good relationships with some of our local ER providers. And so we can call ahead and be like, hey, I'm sending over Johnny. Sounds like you might have an appendicitis. Can you do a quick CT on them? And it just helps them expedite that process. And then we also get, better information back because we're texting the doctor correct immediately and directly. So
Definitely. Do you find with your DPC patients overall that ER visits are reduced? And then I assume their chronic conditions or get better. Like, do you have some either anecdotal or actual data?
absolutely. So we're actually working on some larger employers right now. So we've been doing a lot of data stuff. And on average, we have found that our employees decrease their ER visits by 42% year over year.
Whoa, that's a
Like
huge
it's
number.
right. Well, and it's so hard to get into a primary care provider, right?
Yeah.
It's average length of time to get in this country at this point is 29 days. People will die in that amount of time,
Yeah.
right?
Outside of a physical, there's nothing you should wait 29 days for.
Right. And so patients end up going to the ER because it's their only option. Our patients are significantly happier and healthier just because we do things like checking hemoglobin A1Cs on every patient. We don't wait until their glucose is high. In fact, we check people's insulin levels because that's actually the first thing that's going to change if they're going to be diabetic, not an A1C. Like A1C is great, but that takes 3 months to change. And so you could be like a raging diabetic before we ever check it because your insurance company won't let us check it until your glucose level is too high, which is also a very late determination where an insulin level of 22 yeah, we got to do something now, right? It's just such a backward system. And so, yes, I will tell you, I don't have any, that's the number that I can think of off the top of my head, of how we're helping to keep people healthier. But yeah, I mean, our A1Cs drop because we can talk to them about their nutrition and be like, here's your continuous glucose monitor. I'm going to watch you on my phone because you can do that, right? And I'll be like, what did you eat for dinner today? What was that? It'll send me alerts when my patient's blood sugars go too high. Um,
Really?
and I can't do that when I have 2,000 patients, but when I have, 15 to 20 of them on those things, then it's not a big deal. So,
Nice. That's really cool. That's the way medicine should work.
yeah, sure is.
Okay, so let's talk about misconceptions because I hear all kinds of crazy stuff that people think about DPC that isn't true.
Mhm.
So, what do you encounter, and then how do you help people understand it?
Yeah, the biggest one I get all the time is it sounds too good to be true all the time.
Mm-hmm. Mm-hmm.
So much to the point that we actually put a money back guarantee on our membership. So if you come to our office and in the first 30 days it's not as great as I tell you it is, I will give you your money back. And it's because it's so hard to believe. Just like my husband laughed at me, he was like, that's not real life. We're all used to this really broken system that's what we think it's supposed to be like. And so when we're like, oh no, you can come and see me as many times as you want. Yeah, you can text me and I'll text you back within 2 hours. Oh, you need your refill done? Cool. I'll get it done within 3 hours instead of 3 days. And people are like, what? And wait, how much does that cost? It's like $75 a month. They're like, there's no way. Like, how do you do that? And so that's the biggest thing we get is it's too good to be true. We also get a lot of people who are like, well, why don't you take my insurance? I'm like, well, that's a whole nother, don't get me
How
started on
much
that,
time do you have?
right? I'm gonna talk that. Um, but I think most of it is they just don't understand the concept of it. And it's just different and people don't like change. And so I think that's a struggle for them. Um, I think those are really the biggest misconceptions we have. Some of them do think that we are medical insurance. I'm like, absolutely not. Not medical insurance. You need your appendix removed. I'm not your girl. I can get you to the guy that won't charge you an arm and a leg. But yeah, I think we also get a lot of like, is this concierge medicine? It's like,
Mm,
no, this is different. And the big difference is not only the cost. So DPC is usually less than $100 a month, where concierge is usually around $1,200 a month. But also, your concierge provider is also billing your insurance. So they are basically double dipping into the world. But that's also probably why they will answer their phone at 2 in the morning and I will not. Yeah.
well, Monica, any last thoughts that you would want to share with us?
I mean, I'm just ready for DPC to be as well known as Walmart, right? Like that's our biggest struggle by far is that people don't know it's an option. It's a service they
Yeah.
want and they need, they just don't know it exists. And so the more people that hear about it and talk about it and experience it and tell all their friends, it'll eventually be the common ground, right? People come to my office because they love me. They love my providers. They love what we do and they get to choose. No one comes in my front door because Blue Cross Blue Shield told them they had to. And so because of that, I have to treat them like human beings. I have to show them the value. We have to be kind to them. We have to treat them like real people. And so when healthcare gets back to that, I think we're going to see huge changes across this entire country. But I think that bringing in more DPCs so that we can keep people healthier and stop waiting for them to be sick is really going to revolutionize healthcare in this country.
Well, thank you for your time. I know how busy you are, and I so appreciate your passion for direct primary care and just taking the time to share it with us.
Absolutely. Thanks for having me, Amanda.